South Korea on Thursday revealed its plans for a COVID-19 vaccination rollout, which is set to begin in late February. Doses will be administered in phases throughout the year, beginning with those who need them most. An estimated 50,000 medical workers who are in the front lines of fighting COVID-19. Also in the first quarter, 780,000 residents and workers at nursing homes and 440,000 in medical response teams. Those groups will get the jab in mid-March. And for this stage, the vaccines used will be from AstraZeneca and the World Health Organization's COVAX initiative. And from the second quarter, people aged 65 and older and those working at high-risk facilities for the elderly or disabled, they will then have their turn, and that's a group of more than 9 million. And after the priority groups, the rest of the population will be eligible, and authorities hope to get enough people vaccinated to achieve herd immunity by November this year. But in Korea and around the world, as the pandemic continues to rage on, there's been concern whether the pace of vaccinations are moving quickly enough and whether they'll be effective against fast-evolving variants of the virus. We discuss all of this today with Dr. David Kwak, Professor of Family Medicine and Physician at the Suncheonang University Hospital in Seoul. We also have joining us today Dr. C. Jason Wang, Director of the Center for Policy Outcomes and Prevention at Stanford University. He previously served as the project manager for Taiwan's National Health Insurance Reform Task Force. A very warm welcome to you both. It's lovely to have you on this morning. And well, to jump straight into the discussion, let's start with you, Dr. Kwak, with South Korea's vaccination plan that was released yesterday our time. Now, most Korean adults, they're expected to get the vaccine from July at the earliest after the priority groups get it. And while health authorities, they are doing their utmost to make sure that the vaccines are as safe and effective as possible, many are getting rather nervous though, as we keep hearing news of other countries vaccinating people well ahead of us. And then there's news about the very quickly evolving variants of COVID-19. Are all of these things something that we should be worried about?
I don't think so, because it's mostly going as planned. We are moving into now the originally planned phase that we are starting to vaccinate people. And as you said, hopefully by November, most everyone in the country will get the shot and be immune against the COVID-19. I don't think there's really much to worry other than the fact that not getting the vaccination is more worrisome. Also, in the concerns of different results for certain types of vaccinations, even with the ordinary vaccines for other diseases that we currently have, they are known to have less than 100% efficacy anyway. So still getting the vaccinations is better than getting no vaccinations at all.
So things are moving at an expected pace as planned. But Dr. Kwak, we are hearing about delays of shipments of vaccines to the European Union, though, the AstraZeneca ones. And of course, the Europeans are very angry about this. Do you think there's a chance that Korea's schedule could also be compromised? And even if vaccinations do go as planned, when do you expect most aspects of daily life to return to the pre-pandemic, pre-social distancing times that we used to enjoy?
So in regards to the first question, I would take a guess that Korea would not have such a problem, particularly in regards to the shipment of AstraZeneca's vaccines, because that's currently being developed and manufactured on our soil. It's much less of a logistical problem that we would have compared to other countries overseas. So in regards to the distribution and the availabilities of the vaccines, at least for particularly one or two companies, I don't think we would have as much the problem as the other countries. But in regards to going back to the normal life, I remember Dr. Jerome Kim once said that we might expect up to 5 years before we actually go back to the complete normal life that we used to have. I'm hoping for much shorter time, as our government is planning on immunizing most everyone by the time of November. I'm hoping that most everyone will have immunity against COVID-19, at least by the end of the year, but hopefully much sooner.
Well, hopefully we won't have to wait half a decade before life returns to what might resemble normal. But well, now to bring Dr. Wang into the conversation. Now, Dr. Wang, where you are right now in Taiwan, your health authorities are also set to roll out wide-scale vaccinations in the coming weeks, beginning in March. How are health officials there planning and preparing to distribute these vaccines?
In the past, Taiwan has, for example, in handing out masks, they've used the National Health Insurance card. So, people who showed up with the National Health Insurance card could get 10 masks every 2 weeks. So I would imagine that because there's one system, that people would just use their National Health Insurance card and just get vaccinated when it's available, based on the priorities.
Right, so you have a very, well, Taiwan is known for having a very good electronic, sort of mobile, very high-tech system that's been able to contain the numbers as well. And hopefully we'll hear more of the specifics about your plan in the coming weeks. And of course, your government's already procured around 20 million vaccines, so that's very promising news. But Dr. Wang, we are, though, hearing about some hiccups in vaccination programs, particularly in the US, the United Kingdom, and recently, Germany's vaccine committee said that AstraZeneca's COVID jab should only be given to people aged under 65. And there does seem to be quite a lot of different opinions about the age range. What's so tricky about this? And also, what has been the hardest part about rolling out vaccines that countries like Taiwan and Korea should bear in mind when beginning their own schemes to inoculate people?
Yes, I think as Dr. Kwok pointed out that there's some delays in the production of the vaccines. In the U.S., there's also issues with sort of allocation of the vaccines and distributing them. So in the U.S., we have the federal government basically shipping the vaccines to the states. And then the states are responsible for administrating sort of who's going to get the vaccines. And the states could actually have their own priority. And so when the shipment gets to the states from the federal government, very quickly it has to get distributed to all the clinics. And as you know, based on the priority list, you actually have to generate the patient list that who's eligible to get the vaccine and contact them and get them the appointments. And so just that process alone could take a little bit of time. And some patients, you have to convince them to get the vaccine because in the United States, only about 60% of the people wants to get the vaccine. So, you have to figure out the reasons why they are, not willing to get the vaccine and try to convince them. So, develop educational materials to convince people and use the number of strategies. For example, natural scarcity. You could tell them that this is hardly, it's scarce and that it's available to you, and so that they provide some incentives for them to get the vaccine. And finally, I think there are staffing issues. And so, as you know, all the healthcare workers are very stretched taking care of patients. And so the nurses and the doctors, you need to make sure that someone is available to actually administer the vaccine, and then to make sure that people are safe after they get the vaccine. So there's also, in the U.S., we usually observe patients for 10 to 15 minutes after somebody gets their shot. So all these takes time, getting the list, convincing people, getting the staff ready, and finally recording who's got the vaccine. And so there may be delays in reporting because, just the recording and reporting mechanism also takes a little bit of time. So all of, if you sort of prepare ahead of time, I think the logistics of vaccine delivery and administration could be optimized.
Well, authorities are doing their best. The medical staff, already overworked as they are, they're doing their utmost best. And I suppose the public in countries that are preparing for the vaccine should really also learn to have patience and also really support our medical staff in all of this as well. And well, Dr. Kwok, now the UK decided to extend the gap between the first and second jabs of COVID-19 vaccines from 3 to 12 weeks to make sure that more people get their initial jabs as quickly as possible. But this did raise some concern, though, that this might actually make people's immune systems weaker. What are your views on this?
Well, I wouldn't necessarily think that it'll make people's immune system weaker. More on the other side, if we compare it to other vaccinations, the shorter interval we have for a certain set of vaccines, the weaker the immune system gets. Meaning, let's say for hepatitis A, 2 shots need to be given. If we take the second shot before the interval between is over, then that will make that person's immune against hepatitis A weaker. But on the other hand, if we delay it a couple of weeks, that won't necessarily make that weaker. So I think for this matter also, if we extend the interval period up to 12 weeks, I don't think that'll necessarily make this efficacy of the vaccine weaker. But on the other hand, also, I believe that clinical studies have shown some results that the 3 to 4 weeks of interval originally planned was not as effective as expected. So that's one of the reasons why they extended the period up to 12 weeks. And I think legitimately that needs to be kept globally as well.
And Dr. Kwak, well, both of you have mentioned that it's going to be a challenge actually getting people to come and get their vaccine shots. And Dr. Kwak, now surveys show that vaccine hesitancy tends to be higher in Northeast Asian countries than in other parts of the world. Why do you think this is? And what would be your advice to people who are very nervous about getting the jab?
Well, quite honestly, I think most in the Northeastern Asia, we have been hit rather less harshly than other parts of the world. And so we're less afraid of this gruesome disease than many other countries in the world. So maybe that's one of the reasons why people are more hesitant towards getting the vaccination. But we have to remember the herd immunity, the whole global population getting immunized against COVID-19 is probably the only way we would fight off this gruesome disease. By only reaching the whole global population immunity against this particular disease is the only way that this disease could possibly be eradicated. So I just want to remind, if there's anyone watching, I would like to remind them that whether you like it or not, this vaccination is needed, number one. Number two, it's still better than not receiving the vaccine for your personal safety as well, because with the help of vaccine, you would have at least some sort of immunity against this particular virus that would fight for you.
So really, everyone needs to get on board and do their bit. And well, the trouble, though, the challenge is convincing them to do so. And Dr. Wang, your research has shown that positively framing mask wearing, for instance, can help even teenagers get on board, and this public communication is very important. So how do you think this could possibly be applied to overcome distrust towards vaccines?
Yes, I think, you know, you have to anticipate questions from different demographic groups. So for young people, you know, they have a set of concerns, and for elderly, they have another set of concerns. And so it's almost like a marketing effort where you have to generate a list of questions, Q&A, and so prepare your workforce to answer those questions. And certainly positive framing in terms of, you know, for young people, like if they get the vaccine, you know, and they will feel more protected when they go out, and, you know, they still need to wear a mask. But with the masks, we, for example, have kids design different masks for themselves. And so that you know, there are all these cool masks with like cartoon figures or, you know, superhero figures. And so that make it more attractive to wear a mask. And with vaccines, I think there are some positive messages that we could give to adolescents and even elderly who are hesitating because they also want to go out and enjoy their lives. And so, you know, that requires some thinking and addressing the concerns of different groups of individuals.
And Dr. Wang, before we go, of course, Taiwan is full of these examples, and well, South Korea and Taiwan actually confirmed their first patients of COVID-19 on the same day on January 21st last year. Both never really had a full lockdown and kept infections relatively well contained, although, of course, circumstances changed here in South Korea. How was Taiwan able to keep its numbers low for more than a year now?
I think part of the reason is that the early border control that prevented many cases from coming in, and so most of the cases coming in are actually imported, and then there's the 14-day quarantine to make sure that even if somebody will carry the virus, that at the end of 14 days they're not very infectious. And then for certain populations that are at particularly high risk, they test them and before they are out of the quarantine. And so quarantine, testing, contact tracing efforts, the government has been able to communicate to the public, and the public has really been supporting them in the contact tracing and quarantine efforts. So, to reveal who you have been in contact with, and there's a lot of private information, and so basically you have to get the support of the public, the citizenry, in order for people to reveal their true contacts, and for the government to have effective tracing. And so I think the communication strategies has been working very well, and certainly because of SARS. I think you had mentioned early on, because of SARS, people tend to be more compliant because they know, they're very scared of coronaviruses. Yeah.
Yeah, so communication, very important, and correction to what I said earlier, the two countries didn't confirm their first cases on the same day, but around the same day, around the 20th of January, and Taiwan the 21st. And well, this is where we'll have to end the discussion today. That was Dr. David Kwak, Professor of Family Medicine and Physician at the Soongchunhyang University Hospital in Seoul, and Dr. C. Jason Wang joining us from Taiwan, Director of the Center for Policy Outcomes and Prevention at Stanford University. Thank you both so much for joining us.
Thank you, and
Thank you for having me.
Best wishes to the people of Korea.
Thank you very much.
Thank you.
And to our viewers, thank you as always for watching, and have a lovely weekend.